From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB.
We got 9.
Okay, he'll be here. All right. House Health and Human Services will now come to order. Madam Secretary, please call the roll.
Representative Rayfelt, excused. Representative Fosness, excused. Halverson.
Here.
Jordan.
Here.
Garcia.
Here.
Emery.
Here.
Andera, excused. Kaiser.
Here.
Schaefbauer, excused. Manhart, excused. Baxter. Here. Heineman.
Here.
Mulder.
Here.
We have a quorum, Mr.
Thank you, Madam Secretary. We have a quorum. The chair will entertain a motion to approve the minutes of our last meeting.
So moved.
Moved by Representative Heineman, seconded by Representative Garcia. All those in favor will enthusiastically say aye. Aye. Those opposed, same sign. Our minutes are improved. Or approved. And improved. Yeah. Good morning. Just a few reminders before we begin. Obviously, please silence your cell phones. If you wish to testify, you're welcome to do so, but please sign up through the pages at the iPad or electronically on your phone. If you have some handouts, please distribute them to the pages and they will distribute them to the committee. All questions and comments will flow through the chair to keep us moving. I don't think we will have the need for timed proponent or opponent testimony today, but just be conscious of that and keep testimony non-repetitive, please. With that, Pages, will you please come on up and introduce yourself? Of course, we want to know where you're from, or who you are, where you're from, your class, go to school, what your plans are after college. And then we would like to know your favorite pizza toppings.
Good morning, Mr. Chair, members of the committee. My name is Ethan Estabrook. I'm here from Mount Vernon plan to pursue nursing or pre-med after high school. As for my favorite pizza topping, I would have to say get pepperoni's a classic, then sausage and some black olives.
Sounds like a winner.
Good morning, my name is Ava Davis. I'm from Ipswich. I plan to go to Lake Area for PTA, and I'd say my favorite toppings on pizza is sausage.
Well, thank you for being here this morning and helping our committees run smoothly. With that, we'll take the bills in order as they appear on the agenda. Obviously, we're working through our Senate bills. Our first bill of the day is Senate Bill 90, expand the information required to be sent to the prescription drug monitoring program for each registry identification card holder. We'll take proponent testimony. Good morning.
Good morning, Mr. Chair and the committee. Senate Bill 90 is really to add information onto the prescription drug monitoring card that we have found that is necessary, and as well, hopefully, to get this on the digital card, which we already have spoken in this committee about the process of the digital card. So this will be information going on. At that point, I'd like to just have Senator Nelson come up and present her bill.
Good morning.
Good morning, Mr. Chair, committee members, State Senator Lauren Nelson, District 18. First thing I'd like to do is move Amendment 90A.
And that's obviously posted and online. Can we have okay. We have a motion by Representative Manhart, seconded by Representative Kaiser, to move Senate Bill 90A. This is a voice vote. All those in favor will say aye. Aye. All those opposed say nay. The amendment is approved. You can speak to Senate Bill 90 as amended.
Thank you very much. In 2024, the state legislature passed statutes requiring medical cannabis card holders be included in the prescription drug monitoring program, abbreviated as PDMP. The PDMP is a state-run electronic database that tracks and monitors the prescribing and dispensing of controlled substances. Across the state, with a single click, the PDMP provides access to medication details that pharmacists and other medical professionals need to make safe, confident decisions for patients. State law now provides that the program, the PDMP, must include names of qualifying patients who receive a registry identification card. This requirement is clear and mandatory. However, no card holder information has been entered into the PDMP to date. The heart of the issue is what my colleague from Brookings called an oversight. State law and the subject of the bill requires the Department of Health to show only 2 identifying data points with the PDMP, name and date of birth. The software company used for our state's PDMP requires at least 3. This bill would require 4, ensuring the right information for that patient is available each time. Why does this company require 3 data points? Think back to graphing linear equations. It can be done with 2 points, but using a third serves as an error check. I have 5 Mark Nelsons in my life. If only their names and dates of birth were entered into the PDMP, there would be a problem. 2 of my 5 share the same name and the same date of birth. The company's goal is to get it right. When a professional uses this software, the company seeks to ensure that the correct patient information is identified every time, because patient safety depends on accurate data collection. I clearly understand the intent of the 2024 statute. Marijuana remains classified as a Schedule I drug and is not dispensed through pharmacies, but through dispensaries. It has significant drug interactions, including with sedatives, anti-anxiety medications, blood thinners, and epilepsy medications. When a patient authorized to use medical marijuana receives additional prescriptions, pharmacists and prescribers must have complete knowledge of all the medications to avoid potential dangerous interactions. The PDMP provides a stable, accurate, and universal platform for delivering this information to healthcare professionals in a timely manner. In closing, let's put purpose back into the statute instead of letting it lie useless within our laws. It's about safety for our legal cannabis users. Please vote yes and send SB 90 to the House floor. Thank you.
Thank you. Further proponent testimony for SB 90 as amended. Further proponent testimony. Seeing none in the room or online, we will move to opponent testimony. Is there any opponent testimony for Senate Bill 90 as amended? Seeing none in the room or online, we will move to waive the need for rebuttal and move to committee questions. Are there any committee questions for Senate Bill 90 as amended? Representative Halverson.
Mr. Chair, I'm not sure who this would be for, so I'm just going to throw it out there, okay?
Sure.
I take an aspirin every once in a while. I've never done any prescription drugs, so does this just have to do with medical marijuana, or does this have to do with any prescription drugs that you are prescribed by a doctor?
Senator, would you like to clarify that? Sure. Go ahead and state your name and.
State Senator Lauren Nelson, District 18. The PDMP is for controlled substances. You have your different schedules and stuff. And so that's the key here, is to make sure that our pharmacists, our doctors, everything have access to the information. Again, you might have a, not that the good representative that's a doctor, sometimes doctors don't always know their drug interactions, but yet our pharmacists do. And so that's the key, is to make sure that, if somebody who is a medical marijuana user, comes in, gets a prescription, and, it's not the pharmacist doesn't know that they're using medical cannabis, there could be some serious drug interactions. What I see of it as a safeguard to make sure that our medical marijuana patients are safe when they get prescribed other medications that might interact with that marijuana.
Sure, go ahead.
Mr. Chair, Senator, so this is not just prescription drugs that a person maybe has to get because they've got a health issue. This has to do with mostly just medical marijuana. Is that what you're telling me?
I am not an expert when it comes to what the PDMP, what from my understanding and talking with those that have been directors of the PDMP, what it specifically is used for is to make sure like those controlled substances, medication, the controlled drugs that are being used are tracked, and making sure that individuals are not going from one doctor to the other and getting multiple prescriptions. But yet at the same time, it's also used to make sure that, again, would be great, like talking to them, it would be great to know if medical marijuana card holders, are in the systems, to make sure that when they come in to get a prescription, that pharmacists know that they are also using medical marijuana. And again, it's a safety issue. Just making sure that they know what they're on.
Thank you. Any other questions from the committee on Senate Bill 90 as amended? Do you want to?
Yes,
Okay.
Mr. Chair. Okay,
We'll
so
go ahead and move into committee discussion. Representative Garcia, if you
I
want
think
to.
that's a very important point.
Yep,
What
thank you.
does the prescription monitoring drug program do? And she's right, not everybody understands when they're prescribing what drug interacts with what. So in this case, because it's a Schedule 1, it should be in this program so that we can, as a pharmacist, say I order Eliquis and you're on medicinal marijuana for other reasons, there is a potential for clotting. So that's where they would notify the provider and let them know, so then you'd have to change your medication. So it is for controlled substances, so we don't have over abuse, over prescriptions, multiple providers prescribing somebody something, so that's why you have this program. But it's not like for like digoxin, Cardizem, Carvedilol, none of those drugs go on this. This is all controlled. So class 1, which we don't use at all, but that's like heroin. Then you have class 2, which we had those 2 drugs that came through here, Neptine, and then 3, which is the medetomine that I brought, and then 4 would be more like your Xanax. And those are the ones that they actually monitor. You actually get a fob number. You have to put that into the prescription program monitoring, and then the pharmacist and the DEA, the Fed, they know who's prescribing what. So we're not over-prescribing, and we're not prescribing twice to the same person, and that's why we have the monitoring program. So it's checks and balances for the controlled substances, not for your everyday prescription pills. Okay. Does that answer your question? I'm hoping that answers your question. It's on the CDC website too, you can see it all there. Okay.
Yes, further discussion and or action. Before I take action, I'll make a comment. Yeah, I too was just looking it up. I mean, obviously there's one paragraph sentence right here on the South Dakota Department of Health website. PDMP is a state-run electronic database that tracks and monitors the prescribing and dispensing of controlled substances. By providing healthcare professionals with access to prescription data, the PDMP helps identify potential instances of overprescribing, drug diversion, and other patterns of misuse. So that's right on the South Dakota Department of Health website. We have a motion of due pass by Representative Kaiser, seconded by Representative Schaefbauer. Do you have comments on that motion?
I think this is a good safeguard for a program that's already in place. Make sure there's nothing that's left out to cause any kind of harm going forward. So it's a good bill.
Any other comments on the motion of Senate Bill 90 as amended? Representative Heineman.
Well, if you listen to the Senate testimony, it's a little different than what we're seeing here this morning. And I'm really glad to see the medical community come behind this, because this is necessary. The Schedule 2 and Schedule 3 drugs, well, supposedly marijuana is going to be included in the Schedule 3 drugs this fall, but we'll wait to see if that happens. But it's important that this prescription drug monitoring program have access to people that are on medical marijuana cards, I think. As a practitioner, I appreciate it, because then it allows me to be able to see that the patient actually has the potential anyhow for having this drugs in their system. So I encourage you to support this. Thank you.
Thank you. Yeah, just one final comment. I mean, obviously it's a full picture of what a person is on and using for their medical treatment. So it'll be an easy one for me to support. So with that, we have a due pass motion from Representative Kiner of Senate Bill 90 as amended, seconded by Representative Schaefbauer. All those in favor will say aye. All those opposed will say nay. Madam Secretary, please call the roll.
Representative Rehfeld, excused. Fosnes, excused. Halverson.
Aye.
Jordan.
Aye.
Garcia.
Aye.
Emery.
Aye.
Andera, excused. Kaiser.
Aye.
Schaefbauer.
Aye.
Manhart.
Aye.
Baxter. Heineman.
Aye.
Mulder.
Aye.
10 nays and 3 excused.
Having received a majority of the committee elect Senate Bill 90 as amended, we'll move to the floor with the due pass motion. We can go ahead and certify that for consent.
Mr. Chair,
Why
can
not?
we do consent?
Yeah. We can. We have the power. We'll make it happen. All right. With that, we'll move to our next bill, Senate Bill 15, create the Developmental Disability Service Delivery Committee. We'll take proponent testimony whenever you're ready, Representative.
Thank you, Mr. Chair, members of the committee. Leslie Heineman, District 25. Moody and Minnehaha counties. We have before you Senate Bill 15. It would help to proceed with the process of keeping the committee, the summer study, as some of you would know that, performing its duty that it had been set out to do. I think I should probably acknowledge thank yous to the committee members that were on it. Most of you, and many of you are here today. This committee, the Summer Study Committee, I'll tell you the name of it, Community Support Providers State and Federal Efficiencies Committee, and those were Senator Chris Carr was co-chair. I was co-chair from the House side. Representatives Heather Baxter, Brian Mulder, Nicole Uribalk, and unfortunately Richard Vasgard. He's not with us anymore, as you know. And then Senators Liz Larson, Laura Nelson, and Michaela Boita were members of that committee. I would, before I mention part of the bill, I'll tell you what the committee kind of came up with in directives of where to go in the future. I'll kind of summarize it. You can actually access it online through our website. That it's under Community Support Providers, the interim study or the summer study committee. But I'll highlight a little bit of what the committee came up with as far as recommendations, and it'll lead into why we have Senate Bill 15 in front of you. This committee met 3 times throughout the summer in 3 different locations. And they talked mostly about 2 Medicaid waiver programs, Choices and Family Support, 360. The committee was tasked with identifying opportunities to improve efficiency and better match the ongoing reduced funding of the reimbursement methodologies for service providers. And I won't read the whole report because you can do that yourself if you would like, but I will highlight some things. The Choices waiver currently serves 2,600 adults, 2,690. And those adults, it costs the state an average of $89,647 per person a year. The Choices waiver is about $47.7 million in cost, and the non-residential supports as well as that's $197.5 million for residential. So if you add the numbers together, it's quite a part of the budget. The Family Support 360 waiver currently serves 1,400 adults, 1,420, and children, and that cost is $7,521. Now, if you do the math and figure that out, that's quite a savings if you can keep people in their home and provide care there. The committee members are shaking their heads. That's a big deal, and it never used to be that way, but I won't get into that today. So. And that program itself, the Family Support 360 waiver, is $10.7 million it costs per year. The community support providers face challenges when the state's reimbursement and methodology is not fully funded because Medicaid is their primary source of revenue. We heard that as well. The providers repeatedly emphasize the challenges of delivering comprehensive services and maintaining compliance with state and federal regulations. The other challenges they come up with, overlapping policy and inconsistencies between federal and state rules, state policy reviews and national accreditation was talked about, conflict-free case management services, and the fee-for-service payment rate for day services under the Choices waiver was discussed. We talked about the benefits of a standardized documentation system. Again, it's funny, this legislative session, we spent a lot of time talking about software updates, the lack of software. In fact, with the prescription drug monitoring, that was an issue in the Senate hearing, but it didn't come up today. And the Department of Health has to deal with, and pharmacy has to deal with a different software system or an upgrade to a software system coming up too. So. But the demands of the national accreditation and state policy reviews also was an issue with redundancies being identified. The members commended the department for recent modernization efforts and expressed a desire to see continued progress in improving operations for providers and experiences for families. Again, for families, and I'll get to that just here. I'm almost done. Collaboration, the recommended committee action that we had listed on our website. Number one, collaborate with community support providers, case managers, families, and stakeholders to update the guidance document choices, case managers, and community support providers. It's a pamphlet or guidance that they have. The second is to work with community support providers, case management organizations, families, and their stakeholders to address and reduce overlaps and redundancies. The third was to include either through a waiver amendment or during the next renewal cycle for the choices waiver, a day rate for day services in addition to the current 60-minute billing rate option. So we have for you the bill, draft Senate Bill 15. This bill would establish a legislative oversight committee to examine and monitor changes to the waiver programs. Again, I used the term oversight. I was talking with a couple of you individuals. We did change that to read, and I don't have the exact name in front of me. What is it? The committee is a committee that would delivery committee. Okay, we had a wordsmithing session on deciding what the committee should be called, and that's what we came up with. But that's, in essence, what the Senate Bill 15 does. One of the things I think really is important, and I know a lot of people online are listening, is that the families felt like they had some input. We saw that in all three committees that we met, and 3 times that we met, and they really felt that they were being listened to and that they would like to continue this process. And I think the department I hope they will testify here today, and they are willing to continue with this process. So I urge you to pass this Senate Bill 15 in front of you. Thank you.
Thank
I'll
you.
stand by for questions.
Thank you. Further proponent testimony for Senate Bill 15.
Mr. Chair, members of the committee, thank you for allowing me to provide some testimony here today. My name is Dan Cross, and I represent Community Support Providers of South Dakota, representing all 21 CSPs serving adults with developmental disabilities under the 2 waiver programs that Representative Heineman just mentioned, Choices and Family Support. One thing that the 2025 summer study made clear is that our waiver system is increasingly complex and highly regulated and essential to thousands of South Dakotans. SB 15 provides a structured way for legislators, providers, families, stakeholders, and individuals receiving services to stay informed about important waiver changes. The bill matters for the following reasons, and some of those reasons were highlighted by Representative Heineman, so I'm going to try and skip over those parts. But along the lines of complexity, not only does it affect the national, did we discuss the national accreditation requirements and policy reviews and things like that, but I do want to also note that we fall under the Centers for Medicare and Medicaid Services. And there are certain federal rules that we also have to follow, and those are equally as challenging as the ones that were also noted. And with those particular CMS rules, we're looking at the CMS settings rule and the access rule in particular. Those rules are important, they're complex, and each one of our providers have to follow those. When it comes to major state investments, this is another reason why the bill is important. Representative Heineman did a great job of outlining some of those costs, but I want to make one more note to that. He noted on family support and how the cost difference on that is very significant, and it truly is. But there's also another thing that we should remind ourselves of is the choices waiver and the family support waiver also prevent people from receiving institutional services, which are really expensive. You think the costs of these are expensive? Institutional costs are double that. And that's an important thing to always keep our eye on. Workforce challenges is another issue that we feel the bill would cover, and this committee, this service delivery committee, would be able to more thoroughly examine and keep tabs on. We certainly have workforce issues, not unlike many other industries in the state. But it's important to note that within our realm, we're taking care of very highly vulnerable people. and we need to make sure that we have a stable workforce and able to make sure that that workforce is stable and can continue on into the future. It's also a continuation of important summer study work. We identified multiple inefficiencies during that meeting, and I'm also really happy to tell you that we've been working with the department already, and we are well down the road of starting to address these things that have been identified. But that road is a little bit longer than we thought, and that's why we are here today with Senate Bill 15. So I don't want to belabor the fact of everything that Representative Heineman has already said and mentioned, but we do appreciate the Summer Study Committee, and we feel that this bill is going to continue that work. It's important work, and so I do want to urge you to vote yes on this bill today. Thank you.
Thank you. Further in the room, proponent testimony. Go ahead. Good morning.
Mr. Chair, good morning, committee members. My name is Kevin Dunn. I serve as the director of the Division of Developmental Disabilities within the Department of Human Services. We rise in support of Senate Bill 15. Our work with participants, families, and providers is on a positive trajectory, and we are committed to continuing that collaborative approach while looking at opportunities to strengthen and improve along the way. We remain available to provide information updates at the committee's request, and I would stand by for any questions that you might have.
Thank you. Further proponent testimony in the room for Senate Bill 15.
State Senator Lauren Nelson, District 18. I can honestly tell you it was a complete honor and a privilege and a blessing for me to be on this committee this summer. There's things in my life that happened that changed my life, and this was one of them. This was one of them. And the places that we got to go and the people we got to meet. And the thing about it is coming into being a new legislator and coming into my first committee, summer study, you have that perspective of coming in from the outside. And one of the things that I, noticed right away is that you had families who had, their family members part of this system, and it seems like there was a lot of the things that they needed or wanted were not being heard, and so they would come to us as legislators saying, what can you do, what can you do? And so when this whole summer, I saw myself as that bridge between those behind me, the department and the families, and just being that bridge and being able to bring those two entities together and say, hey, here's what we're hearing from our constituents, people who are in our districts, here's what they're saying. How can, as a department, what can you do? And so I think this bill, this committee is important to continue to get, because again, I see the legislature or this committee as the bridge that brings those two together and gets them talking and working in the same direction. So I would encourage you to support this bill. Thanks.
Thank you. With that, first, is there any more proponent testimony in the room for Senate Bill 15? Seeing none in the room, we will move to online. I'll go ahead and call you online. But at this point, again, just make sure we're not repeating testimony. And if it's just a quick Me Too, that's greatly appreciated as well. We'll start with Steve Watkins.
Good morning, Mr. Chair and members of the committee. Steve Watkins, CEO with LifeScape. I'd ask for your support of this bill. Me too. Thank you.
Thank you. We will go to Pam Hanna. Pam, are you online?
She signed up in person.
Okay, Pam is, I believe, watching, but maybe signed up in person. We'll move to Jody Moratz.
Hi.
Jody.
Hi, I'm Jody Moratz from New Horizons in Watertown, South Dakota. I also support this bill. Me too.
Thank you. Nathan Stallinga.
Nathan Stalling, Executive Director, Dakota Village in Sioux Falls. Me too.
Thank you. Donna Youthy.
Hi, I'm Donna Youthy, the Executive Director of Valiant Living in Madison, South Dakota. Me too.
All right, thank you. Is there anyone I'm missing? Beth Cole? Or Cathol? I don't see.
Good morning. This is Elizabeth Cottle at Ability Building Services in Yankton, and Me Too.
Okay, thank you. Anella, are you on? Anella? I don't see her on there.
She popped up at one point.
Okay. I think we got everyone covered online with that. With that, we will close proponent testimony and move to opponent testimony. Is there any opponent testimony for Senate Bill 15? Seeing none in the room or online, we will move the need for rebuttal and move to committee questions. Are there committee questions? Yes, Representative Halverson.
Mr. Chair, is this a forever committee that we're setting up here?
Mr. Chair.
Go ahead.
Yes, Leslie Heineman, District 25, actually co-chair of the committee. It's actually an excellent question. And we discussed that a little bit in our Aberdeen meeting, the last one. We were urged by the families to have a voice in some way with the department, and the department was open to that, which I give them credit to be as well. And so we decided, as the previous testifier said, we decided we needed a bridge to the future of what we're doing. There were a lot of changes in the waiver system about 1.5 to 2 years ago, actually before I became a legislator. And a lot of those changes really didn't get implemented, or they were in the process of implementing them, and they had a lot of feedback from families that were frustrated with how things were going. And so I'm hoping that we can get those bumps in the road fixed, and then we only requested one meeting. I think that probably that's all we'll need, and it sounds like they're working out their differences, and hopefully at this time next year we can report to you that things are much smoother and we don't need the committee. I can't commit to that. Who knows if I'll be here next year, but the point. You're right. The issue of having committees ongoing is always an issue with the legislature, but in this case, we really didn't have any pushback of people saying, no, I don't think you need it. So.
Yes, Representative Halverson.
This is a little different question, I think, for you, Representative. How many dollars of those huge numbers that you were throwing out there really fast to us are South Dakota monies?
Yeah, Representative Heineman, go ahead.
I'm probably not, I can give you a general idea, but specifically I wouldn't. Actually, the department head would probably be able to, I'm sure he could just rattle them off at the top of his head. No, but there is a large share from federal matching. I think that's kind of what you're getting at. There is a large share. There's no question about that. The matching percentage, the FMAP comes into play, if you're familiar with that. So we end up leveraging a lot of our state dollars with the federal dollars, and there's a huge input to that. If you want a percentage, I'd probably have to ask them if they could come up.
I think you have some volunteers behind you who are willing to answer that question.
Mr. Chair. Yes, Representative Halverson.
Your name, please.
Dan Cross with Community Support Provider, South Dakota. Sorry about that. Yeah, so the federal match is actually about 50-50 currently right now. So 50% of those dollars would be coming from the federal government, and 50% of those dollars would be funded by state government.
Okay, you're getting another question, it looks like. Representative Halverson.
Well, this might be directed to our chair. Mr. Chair, is this monies that we already have probably in appropriations that we're having to deal with right now? Is this something that we have to vote on yet?
Yeah, well, yes, I can answer that question. I mean, essentially, yes, it's part of, quote unquote, the big three when you're talking about providers. But providers are also, we have in the room those who are Medicaid providers in the medical field, medical adjacent, which is the community support providers, behavior health, all of that. That's all part of that umbrella when they talk about community providers, yes. Further questions from the committee? Seeing no further questions from the committee, we have action and or discussion on Senate Bill 15. Representative Indira.
I move to pass.
We have due pass motion from Representative Indira for Senate Bill 15 and a second by Representative Manhart. Comments on that motion, Representative Indira?
Thank you, Mr. Chair. Well, I am the representative for District 10. Dakota Abilities is in my district. I'm a proponent of their service. I've talked to people. This is needed. There's been a lot of confusion. And so I'm behind these guys 100%. And I just hope everybody votes green on this, votes yay.
Thank you. Further comments on Senate Bill 15? Representative Heineman.
Thank you for the support. Thank you to our chair as well, because he's been very helpful with this, navigating this process. But I also I failed to mention that our staff, who actually they're not here because we've had a change in our staff, the health committee, but Anna Madsen has been very instrumental in creating the communication gap between the entities, LRC, the committee, the legislators, and keeping everybody in the loop. So I want to really send a shout out to her. And then Mitch Honan, a fiscal analyst, and Delaney Lewis. They both had to travel to other cities, Aberdeen and Sioux Falls, and they were very, very helpful. So I really appreciate that. And I will say one last thing. I normally lambast summer study committees. I don't like them to much extent, but I do feel this was quite beneficial. So I have to kind of eat my crow a little bit there.
All right, if there's no other comments, I'll just make a comment as well. I think, obviously, again, what Representative Heineman just said, we all kind of question what those committees potentially could look like and if they're going to last in perpetuity or not, referring to the question that Representative Halverson had. But I think in this particular case, when you have to understand that these community providers are fulfilling the role of the state. I mean, if they weren't there, the state's still responsible to provide these services. And that was, back in the day, institutional services of what we know as the South Dakota Developmental Center, or also what's known as Redfield, which is still open and operating, but obviously not to the capacity it once was, not that long ago, quite frankly. I mean, it operated in full capacity in our lifetime. But at the same time, you have this tension where, as we talked about the Big Three funding, and we're looking at potentially a 1% increase for Big Three funding this year, you have this tension where you have a 1% funding, but yet you have a 4.5% wage inflation gap. And then all of a sudden, so they keep on sliding backwards. And then you have to meet all these federal standards, and you have to meet all these accreditations, but yet you're not being funded at the same level. Like, where is that efficiency? And this reaches into every corner of the state. I mean, every inch of this state is touched by this topic and what's taking place. So we have to find efficiencies in our services. We have to find, where can we work better, quite frankly, and cut those out. And then finally, why is the legislature involved is because we change, quite frankly. And this is a complicated, very complicated topic. When you get into federal rule and what's taking place, trying to match these methodologies, what's going on, consistency matters. Somebody here carrying the torch for these individuals, these citizens within the legislature is going to be important moving forward, because otherwise you start talking about methodologies and ICAPs and HCBS services and Family Support 360 and choices, and everyone just glazes over and they go, what? And so I think that's why, I really appreciate the words of the good senator who kind of came in it as a novice. When Senator Nelson came in to see what it is. I don't think he'll mind. Representative Heineman is an expert in these services because he has a brother who's been involved in them for decades. And obviously I play a role in that as well. But that's why I appreciate, the department being here. And that's one final comment I make, is that I will tell you there's been a major shift with the Department of Human Services and the Department of Developmental Disabilities leadership that has been wonderfully welcomed across this state. They're doing a great job, and we're really trying to find our stride, all working together, including families, providers, the department, and it's greatly appreciated. And I can't give Kevin Dunn and those who made the decision to put him in his position, I can't give them enough kudos for what they've been doing over the last year. So that's greatly appreciated as well. So with that, we have a due pass motion of Senate Bill 15, made by Representative Mandera, seconded by Representative Manhart. All those in favor will say aye. All those opposed will say nay. Madam Secretary, please call the roll.
Representative Rayfelt, excused. Fosnes, excused. Halverson.
Aye.
Jordan.
Aye.
Garcia. Aye. Emery.
Aye.
Andera.
Aye.
Kaiser.
Aye.
Schaefbauer.
Aye.
Manhart.
Aye.
Baxter.
Aye.
Heineman.
Aye.
Mulder.
Aye.
11 ayes, 2 excused.
Having received the majority of members-elect, Senate Bill 15 will move to the floor with a due pass motion. And we might as well put it on consent. All right. Senate Bill 87. Clarify and establish requirements related to forensic medical examinations. We'll move to pro-opponent testimony. Good morning, Senator.
Good morning, Mr. Chair, committee members, Tim Reed, District 7. And I bring before you today Senate Bill 87. This bill focuses on strengthening the pathway between hospitals, clinics, and sexual assault response teams when a victim of sexual assault presents for care. In those first few hours after an assault, 2 things must happen well. The victim must receive compassionate and appropriate medical treatment, and any forensic evidence must be properly collected and preserved. This legislation ensures hospitals have clear written policies that outline how they coordinate with sexual assault response teams and law enforcement, whether exams are conducted on-site or through referral. By establishing clear expectations in this statute, we create greater consistency across the state so that victims can expect a similar standard of response regardless of where they are seeking care. Formalizing that coordination improves outcomes for victims and strengthens the integrity of evidence that may be ultimately used in prosecution. So why is this important? A sexual assault forensic examination may not be the path to a 100% successful prosecution rate, but having that exam makes 3 things possible. It creates opportunities for connection with the victim, making it more likely that the rape will be reported. Medically and psychologically, it provides benefits for the survivor, and when they receive trauma-informed, compassionate care. It creates a possibility of a forensic yield, which makes it more likely an offender will be arrested and prosecuted. Looking through the bill, giving you just an idea of what it does, the first few sections is a little bit cleanup, and because of language that we needed to add to the main sections that I'll get to, we had to do some changes to those sections. For example, Section 1, we realize it's not just physicians, and so we put provider, and you'll see that we actually define who those providers can be later on in the bill. And then we make sure that we use the same term throughout the language in the statutes for this of forensic medical examination. The heart of the bill really starts at the end of the Section 5, page 4, lines 1 through 7. And here we start to, or we will, define a couple important terms, and that is what is a sexual assault nurse examiner, and then what is a sexual assault response team. We had to make sure we got that into code. Section 6 then says who can do these sexual assault forensic medical examinations. We've never listed that before. And as you can see, there's 4 folks listed there, or 4 different professions listed there. Physicians, PAs, nurse practitioners, sexual assault nurse examiners, of course, are well trained in doing this. It goes on to say that the hospital has to make sure these folks are trained to do that. And then it also says if you have the ability for, and a lot of times it's called e-SANE, but basically a remote, you can get remote help. So if there's a hospital that doesn't have somebody trained there to do it, then they can use remote, some of the remote capabilities to get someone that has been trained to be able to do these examinations. Then Section 7 actually gets into having that policy, to make sure hospitals have that policy. And that includes whether the hospital provides that or not. All our hospitals don't have the capability of doing that, actually having doing the sexual assault forensic examinations. But if they don't have that, then they have to figure out a timely way to refer that victim that presents themselves to another facility that can do the examinations. It also talks about how they coordinate with law enforcement and sexual assault response teams, and then addresses how the hospital provides information to the patient of an examination, and that way they also will know the availability and resources of victim advocates. Section 7 it talks about that through a hospital, and Section 8 is basically the same, except it talks about that they can do it in a clinic. Where you live in the state should not dictate whether you are able to get forensic examination in a timely, appropriate manner. As a large, mostly rural state, this legislation is a good step to addressing the shortfalls in this area. The ultimate goal is making sure the victim that presents themselves will continue with examination and hopefully prosecution. I'll stand by for questions. Thank you.
Thank you. Is there further proponent testimony for Senate Bill 15? Or not Senate Bill 15. Senate Bill 87. Senate Bill 87. Further proponent testimony for Senate Bill 87.
Or whichever bill, Mr. Chair. Tim Ravestow, just very briefly, Mr. Chair, rise to support of the bill, and I really want to thank the good senator for his patience working with us through some logistical day-to-day concerns we had with the way the bill was previously drafted. He was very patient and put together, I think, a good piece of legislation. Ask for your support. Thank you.
Thank you. Further proponent testimony for Senate Bill 87.
Good morning, Mr. Chair and members of the committee. Kim Malson-Reisen with Avera Health. We too stand in support of Senate Bill 87, and I would echo the previous testifiers' comments. The folks working on this, including the prime sponsor in the Senate, was great to work with, very collaborative, and I think we've got a good product as a result. So we'd urge your support. Thank you.
Thank you. Further proponent testimony for Senate Bill 87.
Good morning, Mr. Chair, members of the committee. Alan Solano, Monument Health in Rapid City. Just simply provide a me too for what was previously stated, and thank the prime sponsor for working with all the stakeholders to make this a really good bill. Thank you.
Thank you. Further proponent testimony in the room for Senate Bill 87.
Good morning, Mr. Chair and committee members. Melissa McCauley, registered lobbyist for the South Dakota Network Against Family Violence and Sexual Assault. And we strongly support this bill, and we also want to say thank you for the prime to bring this and working with everybody to get this through. So please do.
Thank you. Further in the room, proponent testimony for Senate Bill 87. Seeing none in the room, it looks like we have one online. Tracy Decker. If you can hear me and want to unmute.
Hi, good morning.
Good morning.
Mr. Chair and committee, my name is Tracy Decker. I'm testifying on behalf of myself as a proponent of this bill. I'm a resident of Rapid City. I am currently employed by the South Dakota Network, but I spent most of my adult career as a prosecutor. For almost 20 years, I prosecuted sex crimes in Pennington and Meade counties, crimes against women, men, and children. So I just want to say a few words about this bill from a public safety and prosecution standpoint. Collection of evidence in these cases is significant. Obviously, medical care and taking care of the patient is first and foremost, but sexual assault cases often hinge on this forensic evidence. And since South Dakota is such a vast and rural state, it's really important to investigators and prosecutors and survivors alike that no matter where a person ends up, they get the same treatment, that there's consistent procedures. Inconsistent procedures can create real challenges to the reliability and scientific integrity of evidence. So these type of standardized protocols that we're talking about here would help meet courtroom scrutiny statewide. Justice really should not depend on which hospital a victim happens to reach. We need providers prepared in some fashion, wherever they are, to do their part so that evidence isn't lost. And knowledge of this type of exam and how to do it is really important, and this law will help ensure that that is happening. It'll help ensure communications between providers and law enforcement, which is so important. I'm not going to get into a lot of detail about how underreported sexual assault crimes are, but they are underreported. Yet South Dakota and Rapid City consistently have very high numbers of sexual assault in FBI and Department of Justice statistics. But despite that high number of reporting, conviction rates remain pretty low because these are some of the hardest cases for law enforcement and prosecution to prove, despite valiant efforts by both groups. So these consistent statewide practices will hopefully lead to more evidence collection, which will lead to more potential for arrests and lead to more efforts at prosecution and overall more offender accountability. So I think that this bill is just as much about public safety as it is about patient care. And I would just emphasize it shows how important of a role medical providers can play in public safety along with their care for the patient. So in support of public safety and offender accountability, I urge you to support this bill, and I appreciate your time this morning. Thank you.
Thank you. Do we have any further proponent testimony for Senate Bill 87? And Ms. Decker, if you could just stay on for questions in case the committee has some for you, that'd be great. Seeing no more proponent testimony for Senate Bill 87, is there any opponent testimony for Senate Bill 87? In the room or online? Seeing no one moving, we will skip or waive the need for rebuttal and move to committee questions. Are there any committee questions? Representative Heineman.
Thank you, Mr. Chair. I support the concept. I'm totally fine with that. I'm just the change you had from physician to provider, I guess, and this probably would be for Tracy Decker. I'm guessing she would probably be the one. So have the courts, okay, I understand the sexual assault part, and I think it's appropriate. You added sexual assault nurse examiner. I'm okay with that. But if you have somebody come into your ER and they're considered a medical expert in some way, shape, or form, it's like a gunshot wound, or it's something that causes other things besides sexual assaults, are the courts going to recognize someone else besides a physician as the person doing that forensic medical exam?
Ms. Decker, do you think
Chair?
Do you think you're okay? Go
Yes.
ahead. Just go ahead and
Thank
state
you.
your name
Yes.
for the people online. Thanks.
Yes, Tracy Decker, Rapid City. Yes, it really depends on each situation what the court will recognize. But most providers, in my experience, most providers that have the medical training to be in that position in the first place, and then the additional amount of training that it takes to be able to perform these exams has been well accepted by the courts across South Dakota. And I would also point out that the people doing these exams don't necessarily always have to be recognized as experts. They can also testify as what we call fact witnesses, where they're literally just testifying about the treatment they provided, the evidence they collected, what they saw, and what they heard. And you don't have to be an expert to be able to do that. But prosecutors all across the state and judges understand how to ask the right questions to get to these issues and draw out the training of all of our statewide providers to be sure that their testimony is accepted in courts.
Okay, thank you.
Thank you, Ms. Decker. Further questions on Senate Bill 87? I believe Representative Garcia has a question.
I do. I think this might be for Tim Raves. I'm not sure, but I'll ask the question. So, is there a certain certification for these? A certification that they have to go through, like, I'm just comparing it to like ATLS or something like that, because everything is about detail when you're collecting the information on an assault victim. So do we have a specific certification or criteria that has to, standardization that has to be met in the facility? I'm not sure who could answer that. I'm just asking a question.
Thank you for being available to answer that question. Go
Mr.
ahead.
Chair, thank you, Representative Garcia, for that question. So in the
Just go ahead and state your name.
Oh, I'm sorry, Kim Olson Rising with Avera Health. So in the case of SANE nurses, those are sexual assault, specially trained nurses, and there's a curriculum and a certification that goes with that to get that level. For other providers that would do these exams, there would be additional training beyond their medical training to ensure that they can complete those correctly.
But in the facilities, do we have, I'm sorry, Mr. Chair, do we already have a standardized, like you have to hit this criteria in order to perform these things? Is that universal in South Dakota? I'm not sure. It might be a dumb question. I'm just wondering if there's something.
Yeah. Mr. Chair, Kim Olson Rising with Avera. Again, there wouldn't necessarily be an accreditation within our system, but we would have specialized training on our policies to be able to complete these kinds of procedures correctly.
Follow up, Mr. Chair. I guess what I'm asking is there a certification for this type of, that you say you have special training, do they get a certification so they have that on file? I'm just thinking for the courts and when it goes through and you get to an expert that you've had, again, might be a dumb question. I just need clarification.
Sure. Mr. Chair, Kim Olson Rising with Avera. No, there's not a specific certification.
Thank you. Further questions? Representative Halverson.
Mr. Chair, from my past law enforcement experience, I know the chain of evidence is very important. And so let me see. I'll direct this one to Kim again.
Good thing she's getting her steps in.
Mr. Chair, maybe I was dreaming, but did I hear a remote examination? Can you describe what that would be?
Go ahead.
Mr. Chair, Kim Olson Rising with Avera. So, and I can speak to Avera's experience with this. So we contract with a company that has 24/7, 365 days a year access to specially trained, SANE nurses who can provide that oversight in the case of a person treating a victim who needs that additional help to collect that evidence. And so it's literally done through telehealth, and it's a collaborative process so that that evidence is collected in an appropriate way that can be used for prosecution, as well as, consistent with trauma-informed care. So it would just, if you think about how telehealth is provided in a lot of different types of services, it would be very consistent with that, where you've basically got two providers, one who's with the patient in the room and one who's there remotely, collaboratively providing that care.
Yes, Representative Halverson.
Okay, so I got that part of it, but when you're talking telehealth, I would think that with a rape case, that you're going to have physical evidence. Now, how do you transfer that by telehealth?
Mr. Chair, Kim Olson Rising with Avera again. So the way that this would work is that the telehealth provider would be guiding that person who is with the patient on the collection of that evidence to ensure that it's collected properly and will have the best case for prosecution. So it will be very detailed in terms of the process involved with that. Ensuring that the evidence is not compromised in any way through the process that's being used.
I think what you're maybe asking, though, is then the transportation of the actual evidence.
So in that regard, Mr. Chair, the evidence itself is, we have processes in place to store evidence, and there's statute kind of regarding that, and so it remains on site until it is transported by law enforcement in the need for their work. So we keep the evidence until law enforcement collects it. So it's not, the telehealth part is just with the collection of it.
Okay. Thank you. Further questions? Representative Shapar.
For Ms. Decker.
Okay.
So with all these new terms, and I guess I'm not sure if there's new procedures. What has been happening now? Is the evidence not being collected in an accurate way? I mean, how would this bill change what is happening right now in South Dakota, except for it being, a blanket policy across the state? I mean, are we lacking response to sexual assault? Are we lacking in, reporting sexual assault? How does this help us in South Dakota?
Go ahead, and if you could just state your name one more time, thanks.
Thank you, Mr. Chair. Tracy Decker. Thank you for that question. That's a really good question. What this bill is seeking to remedy is the lack of care and examinations that do happen across the state. Both as a prosecutor and in my current job working for the South Dakota Network, I have a lot of contacts with survivors and victim advocates statewide, and there's consistently stories being told and victims coming forward talking about being turned away from rural health care because they're told we don't do those type of exams here, and they're kind of left to their own devices to figure out where to go and what to do. Obviously, medical providers want to provide compassionate care, but they sometimes feel intimidated by these type of exams, so they're not doing them. So a lot of times what happens then, or victims are also waiting in emergency departments for hours while facilities are waiting for somebody to say drive from Sioux Falls that is qualified to do the exam. So what we're hoping to do here is fill some of those gaps, and the medical establishment has worked really well with Senator Reed over the last year that we've been working on this bill to make sure they can fill those gaps in a way that the medical providers can handle, that will help these victims coming into these facilities. Because oftentimes when the victim leaves that facility being told we don't do those exams here, or the wait is going to be 6 hours, or whatever the reason is, they often just leave and go home, and we never hear from them again, and they never report. So that is happening I would say all over South Dakota. I have stories from all regions of the state. So those are some of the gaps we're looking to fill with this.
Any further questions from the committee? Seeing none, we'll move to committee action and/or discussion on Senate Bill 87. Representative Schaefbauer.
Can I ask one more question?
Sure.
For Ms. Decker again.
Ms. Decker, I guess we have one more question.
Yep, sorry about that. I was kind of forgot what I was going to ask. But so now with this new law, we should be seeing more in reporting of sexual assault, or just the way the sexual assault is handled if reported?
Mr. Chair.
Go ahead. Just one more time your name. Thank you.
Yeah, Tracy Decker. Representative Schaefbauer, hopefully both will be true. We'll see better handling of sexual assault patients and more evidence collection, which I believe will lead to more reporting, because that first contact that a sexual assault victim has with any part of the system, and they see that medical provider as a part of the system because they don't know any different, that first contact is so important with how they choose to interact with the rest of the system. So I do have high hopes that this bill will not only provide better healthcare outcomes for these victims, but also better relationships system-wide that will lead to more reporting.
Thank you. Okay, we'll move to committee action and/or discussion. Representative Heineman.
I move due pass on Senate Bill 87.
We have a due pass motion by Representative Heineman, and seconded by Representative Andera. Any comments on that motion, Representative Heineman?
Thank you, Mr. Chair. I think that it's been demonstrated the senator has done his work. He's worked with the partners, and it appears that we can expand the ability here to provide care out in the rural areas. I think that's a great thing, so I urge your passage of this.
Thank you. Further comments on the motion of due pass for Senate Bill 87? Further comments? See no further comments from the committee. What we had before us is a due pass motion of Senate Bill 87, made by Representative Heineman, seconded by Representative Andera. All those in favor will say aye. All those opposed will say nay. Madam Secretary, please call the roll.
Representative Rayfeld excused, Vosnes excused, Halverson.
Aye.
Jordan.
Aye.
Garcia. Aye. Emery.
Aye.
Andera.
Aye.
Kaiser.
Aye.
Schaefbauer.
Aye.
Manhart.
Aye.
Baxter. Heineman.
Aye.
Mulder.
Aye.
11 ayes, 2 excused.
Having received the majority of members-elect, Senate Bill 87 will move to the House floor with a due pass recommendation. And we can go ahead and certify that for consent as well. Okay, with that, we are at the end of our agenda today, and hang on. I will let you do that. I will let you do that. But real quick, I'm almost nervous to say this, but at this point, we have no bills on our log. So we'll see what gets read on the House floor today. So I cannot promise you Tuesday at this point, a day off, but we will see what is read on the House floor today, and then go from there. What that looks like. So with that, I hope you all take time to warm up your dodgeball arms and get ready for next week, because Representative Garcia is pretty excited about that. If you tend to do that or want to do that, and yeah, I'll be in touch via email regarding some other business as well. So please pay attention to that. With that, Representative Manhart. We have a motion to adjourn, a second by Representative Kaiser. All those in favor will enthusiastically say aye. Aye. All those opposed say nay. We are adjourned.
SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota legislature and in-depth reporting from peer. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB.
Good morning and welcome to Senate Commerce and Energy. I would ask everyone to please take a seat and have your phones turned to silent. If you plan on testifying today, please sign in at sdlegislature.gov. Press the people icon or link next to the agenda and fill out the form. Or you can do this directly on your phone by scanning the QR code on the agenda above the podium. And if you don't know how to sign in, ask one of these folks with the yellow shirt. They'll help you sign in there to testify. At this time, I'd ask the secretary to please call the roll.
Senators Melhoff,
Here.
Dybert, excused. Hone. Here. Carr, excused. Kobeck, excused. Larson. Here. Perry.
Here.
Peterson. excused. Crabtree.
Here.
Mr. Chair, we have a quorum.
Thank you. At this time, I would entertain a motion to approve the minutes of our last meeting. Moved by Perry, seconded by Larson. All those in favor say aye.
Aye.
All those opposed say no. The minutes are approved. A reminder, testifiers, please sign in at the back of the room there, and lobbyists, make sure that you've got your badges clearly visible. If you have any handouts, please have the pages distribute those for you. At this time, I'd ask the pages to come on up, introduce yourself, and tell us a little bit about your future plans.
Hi, I'm Layla Williams from Hill City High School. I'm a senior. After graduation, I'm going to attend Flagler College in St. Augustine, Florida. I'm majoring in poli-sci, and I will pursue a law degree somewhere.
Well, the weather's terrible down there, so I hope you move back to South Dakota.
My name is Hannah DeLine. I'm a senior at Mitchell Christian High School, and I plan to attend a four-year university majoring in kinesiology with a minor in criminal justice.
Awesome. Well, thank you both for your service here over the next week. With that, I just remind everybody that all testimony and all questions are going to be addressed through the chair. We've got a busy day as far as executive appointments go, and then a couple bills to follow. We're going to go ahead and get started with the executive appointment of Lynn Evans, Pennington County, Rapid City, South Dakota, to the South Dakota Science and Technology Authority. We will take proponent testimony at this time.
Good morning, Mr. Chair, members of the committee. Aaron Scheibe, an attorney from Pierre, registered lobbyist for the South Dakota Science and Tech Authority. Mr. Evans had a personal commitment this morning and is not going to be available, could not reschedule that. So if you will permit me, Mr. Chair, I'd like to just share a little bit of information about Mr. Evans and then ask for your support.
Absolutely.
So Lynn Evans has lived in western South Dakota for 36 years with his wife Gloria, who was raised in Deadwood. Evans became a member of Black Hills Corporation Board of Directors in 2018 and was appointed president and CEO of Black Hills Corporation in January 2019. Prior to being named CEO, Evans served as president and chief operating officer from 2016 to 2018 and president and chief operating officer of the utility segment from 2004 to 2015. Joining Black Hills Corporation in 2001, Evans also served the company as Associate General Counsel, VP and General Manager of the firm's telecom, cable, and internet services business, Black Hills Fibercom. Prior to that, Evans gained deep operations management experience within the mining industry and underground gold, iron ore, lead, and zinc mining operations throughout North and South America, including leadership roles at the Homestake Mine in Lead, where he held positions managing shafts, rock crushing units, and deep underground mine development, planning, and production. He also practiced law with private firms representing international mining companies in various areas, including corporate law, local, state, and federal permitting, property rights, mineral taxation, eminent domain, and civil and regulatory litigation. He currently serves on the boards of the Edison Electric Institute and the American Gas Association, and additionally serves on the South Dakota School of Mines and Technology's Advisory Board and the Sanford Underground Research Facility Foundation Board as well. He holds a Bachelor of Science degree in Mining Engineering and a Juris Doctor degree from Northwestern School of Law and Lewis and Clark College. And he is admitted to practice law before state and federal courts, including in South Dakota. He was also previously a licensed professional engineer. He's now in active status on that. He and his wife Gloria enjoy serving on several local charitable boards, advisory committees. They're the parents of 3 grown daughters, all of whom graduated from South Dakota universities, and they're the proud grandparents of 2 grandsons. So when you think about the Science and Tech Authority and the Sanford Underground Lab, you really want somebody with pretty deep operations experience, executive leadership experience serving on this board, somebody who understands the mining world. I think all of what I've just described to you is readily apparent that Mr. Evans is a great choice for this board. And Mr. Chairman, I would urge your support. Thank you.
Thank you, Mr. Scheibe. Any further proponent testimony on the executive appointment of Lynn Evans? Any further proponent testimony? Seeing none, we'll close proponent testimony and go to opponent. Is there any opponent testimony on the executive appointment of Lynn Evans? Seeing none, the committee will open this up then for committee questions, discussion, and or action on the executive appointment of Lynn Evans. Senator Perry.
I would move advise and consent for Lynn Evans.
We have a motion made by Senator Perry. We have a second by Senator Melhoff. The motion in front of the committee would be the executive appointment of Lynn Evans, Pennington County, Rapid City, South Dakota, to the South Dakota Science and Technology Authority. Comments on your motion, Senator Perry?
the information that we just received from the proponent tells us that we have a great candidate for this position, and we should all say yay.
Any further discussion on the motion? The chair would just provide a little comment as well that I've had the pleasure of meeting Lynn Evans a couple of times. Extremely smart person, and I am thankful that we have folks like that in South Dakota that want to serve and be part of the fabric of our economy and some of these boards. And so really appreciate him given that time. At this time, I'd ask the secretary to please call the roll.
Senators Melhoff,
Aye.
Dybert, excused. Hone.
Aye.
Carr, excused. Kobeck, excused. Larson.
Aye.
Perry.
Aye.
Peterson, excused. Crabtree.
Aye.
Mr. Chair, we have 5 yeas and 4 excused.
After receiving a unanimous number of votes, the executive appointment of Lynn Evans, Pennington County, Rapid City, South Dakota, to the South Dakota Science and Technology Authority is hereby deemed passed. Senator Kolbeck will carry that one on the floor. Next up is the executive appointment of William Even, Lincoln County, T, South Dakota, to the position of Commissioner of the South Dakota Governor's Office of Economic Development. We'll take proponent testimony at this time.
Thank you, Mr. Chair, members of the committee. My name is Mackenzie Decker, Chief of Staff for Governor Larry Roden. It is my honor and pleasure this morning to ask for your favorable consideration of the executive appointment of William Even for Commissioner of GOED, Governor's Office of Economic Development. I will call him Bill for the rest of this. That's all right with you. I'll make this short and leave out the details of his impressive career and South Dakota roots. They are important, of course, but what is more notable is that in just 10 months on the job, Commissioner Even helped broker the largest economic project in South Dakota history by a 2-to-1 margin. I could leave it at that, but that only scratches the surface. Equally, if not more important, I've met very few people with the same high levels of both integrity and intelligence as Bill Even. He is the right person to lead GOED into the future. He's here today and may say a few words, but certainly would take your questions if you have any. I'm asking on behalf of Governor Roden and the state of South Dakota to support the confirmation of his executive appointment. Thank you.
Thank you. We'll take further proponent testimony on the executive appointment of Bill Even.
Morning, Mr. Chair, members of the committee. Mike Bockerny, CEO of the Economic Development Professional Association of South Dakota. We would just like to offer our full support of Bill into this position. In the time that we've been able to work with him, and I've been able to work directly with him and his staff, it's been an absolute pleasure to do so. One thing that I would like to point out that Commissioner Even has brought across the state is fantastic communication. And that is very important, and our members appreciate that very much. So we would very much appreciate your support of his appointment. Thank you.
Further proponent testimony on the executive appointment of Bill Even. Any further proponent testimony? Seeing none, we'll close proponent testimony and move on to opponent testimony. Is there any opponent testimony on the executive appointment of Bill Even? Seeing none, we'll open it up to committee questions. Senator Hone.
Mr. Chair, can I make a comment or two?
We'll go committee questions, discussion,
Okay.
and or action. Go ahead, Senator Hone. Go ahead.
Well, I have no questions if anyone else does.
You can go on to comments.
Okay. So I just want to talk personally about Bill. Our friendship dates back to our time as classmates. Prior to that, our parents were lifelong friends. Bill's parents and family are highly respected in our community. Bill and I grew up as neighbors, just 6 miles apart on our family farms. Bill and his family own and operate a diversified crop and livestock farm near Humboldt. Bill's work ethic came from the farm, and he has a strong work ethic, a deep responsibility, and a resilience. He's resourceful and a problem solver. However, one of his greatest traits is being an effective listener, a crucial skill that will serve him well in his new position. I'd also like to recognize his wife, Janelle. Behind every successful man is a woman who believed in him. She is beautiful inside and out. She is Bill's balance and strength. Janelle and her family are also esteemed members of our community. Janelle is a public servant serving various roles in education. Together, Bill and Janelle are a solid foundation in our community. It is with the greatest respect that I support Bill Even for the position of the Commissioner of the South Dakota Governor's Office of Economic Development. Thank you.
Thank you. Further questions, discussion, and or action on the executive appointment of Bill Even? Senator Perry.
Mr. Chair, motion. I would do advise and consent that Bill Even become the person that represents us for the Governor's Office of Economic Development.
We got a motion from Senator Perry, a second from Senator Hone. Any further comments on your motion, Senator Perry?
I've had the opportunity to work with Governor's Office of Economic Development through the years, and this individual is going to do an outstanding job. He understands people, and he cares about people, and he does listen, and he is concerned, and he would be it would be a good decision for us all to put him into that position.
Further comments on the motion? Any further comments? The chair would just add that I too have had the chance to work with Mr. Even, both professionally and of course inside this building, and I have found him to be an outstanding person. I think all things in this state are about relationships, and there's very few that build them with a sense of trust and integrity like Mr. Even does, and so I think he'll do a fantastic job in this role. The motion in front of you that was made by Senator Perry and seconded by Senator Hone is for the executive appointment of William Even, Lincoln County T, South Dakota, to the position of Commissioner of South Dakota's Governor's Office of Economic Development. Would the Secretary please call the roll?
Senators Melhoff,
Aye.
Dybert, excused. Hone,
Aye.
Carr,
Aye.
Kolbeck, excused. Larson,
Aye.
Perry,
Aye.
Peterson, excused. Crabtree.
Aye.
Mr. Chair, we have 6 yeas and 4 excused.
After receiving a unanimous number of votes, the motion for the executive appointment to advise and consent to the executive appointment of William Even, Lincoln County T, South Dakota, to the position of Commissioner of the South Dakota Governor's Office of Economic Development is hereby deemed passed. Senator Hone will carry that on the floor. Next up is the executive appointment of Roy Lindsay Jr., Lake County, Madison, South Dakota, to the South Dakota Lottery Commission. We'll take proponent testimony at this time.
Morning, Mr. Chair and members of the committee. Norm Lingle. I'm the Executive Director for the South Dakota Lottery. And I'm appearing here on behalf of Roy Lindsay's appointment to the South Dakota Lottery Commission. Currently, Mr. Lindsay is a resident of Madison, where he has been serving as mayor since 2022. Previously served as mayor of Madison from 2013 to 2019. Has spent many years in education, business, and public service. Mr. Lindsay continues to be actively involved within the Madison community, including the St. Thomas Catholic Church, St. Thomas School Foundation, the VFW, American Legion, and Knights of Columbus. And with that, Mr. Chair and members of the committee, I would ask for your advice and consent to the appointment of Roy Lindsay to the South Dakota Lottery Commission.
Thank you, Mr. Lingle. We'll take further proponent testimony on the executive appointment of Roy Lindsay Jr. Any further proponent testimony? Seeing none, I believe Mayor Lindsay is online, just for those that are in the committee here as well. So we'll close proponent testimony. We'll move on to opponent testimony. Is there any opponent testimony to the executive appointment of Roy Lindsay? Seeing none, we'll waive rebuttal and open it up for committee questions, discussion, and or action on the executive appointment of Roy Lindsay Jr.
Mr. Chair.
Senator Melhoff.
I'd move that we advise and consent with the appointment.
We have a motion to advise and consent from Senator Melhoff and a second from Senator Perry. Comments on your motion, Senator Melhoff?
Sounds like a fine man for the job, so I would urge your support.
Any further committee comments? Well, the chair would agree with the good senator from Pierre. I know the mayor's joining us online. I've known the mayor for a long time, and he is a true public servant. We're lucky to have him serve on this board, and I'll be, if you're all willing to advise and consent today, I'll be willing to speak on his behalf on the floor. So the motion that is in front of you is to advise and consent to the executive appointment of Roy Lindsay Jr., Lake County, Madison, South Dakota, to the South Dakota Lottery Commission. That was made by Melhoff, seconded by Perry. Will the secretary please call the roll?
Senators Melhoff.
Aye.
Dibert, excused. Hone.
Aye.
Carr.
Aye.
Kobeck, excused. Larson. Aye. Perry.
Aye.
Peterson, excused. Crabtree.
Aye.
Mr. Chair, we have 6 yeas, 3 excused.
Thank you. After receiving a unanimous number of votes, the motion to advise and consent to the executive appointment of Roy Lindsay Jr., Lake County, Madison, South Dakota, to the South Dakota Lottery Commission is hereby deemed passed. All right, moving on. We're going to go now into executive reappointments. Our first executive reappointment is for Stephen Zelmer, Pennington County, Rapid City, South Dakota, to the South Dakota Building Authority. We will take proponent testimony at this time.
Good morning, Mr. Chairman, committee members. Don Templeton, Executive Secretary of the South Dakota Building Authority. Steve was not able to dial in today. I did distribute a handout, hopefully, that you have. I'm just going to walk through it quickly, but Steve has served 3 4-year terms for the Building Authority, and he agreed to serve another term if so confirmed. He was appointed to the Building Authority in 2014. He's been a great board member that's very active in our meeting, and I'm going to walk through a quick walk through his background. He's just great for this board. He graduated from Augustana. He's got an MBA from University of South Dakota. Past employee of LRC, past Secretary, Department of Revenue, past Commissioner of Bureau of Finance and Management, and past President of the Dakota Cement, past member of the Governor's Council of Economic Advisors. So he's just super sharp guy and a great board member. And I urge your support.
Thank you, Mr. Templeton. We'll take further proponent testimony on the executive reappointment of Stephen Zelmer. Representative.
Thank you, Chair Committee. Steve Duffy, Rapid City. I've been asked just to make a couple of comments about Steve. I can only tell you I haven't met many people like that. He's just a genuine guy. He's 10 years older than I am. And just last weekend, we were at a birthday party, a mutual friend's birthday party. And he's insatiable in curiosity. And you heard he spent a bunch of his life in state government. He's a genuine guy. He's thoughtful. He's honest. And if you don't want to know what he thinks, you shouldn't ask him. But it's all reasoned. I mean, he's just got that gift. He's smart, but he doesn't make you feel stupid when you ask questions. He's really curious. He told me, he says he's an optimist. And I said, well, what do you mean by that, Steve? He goes, well, you could probably calculate his years of age roughly. He said, and I just bought new skis for this winter. They're $1,000 a pair, or $2,000. But he worked, and he has great stories about Governor Janklow in particular. And but he has the experience, he has the knowledge, and he's curious, interested, and he loves South Dakota. He's a South Dakota boy from the get-go, and I sure support him.
Thank you. We'll take further proponent testimony on the executive reappointment of Stephen Zelmer. Seeing none, we'll open it up for opponent testimony. Is there any opponent testimony to the executive reappointment of Stephen Zelmer? Seeing none, we'll open it up to committee questions, discussion, and/or action. Senator Melhoff.
Mr. Chair,
Go
Based on the testimony of Representative Duffy, I'm concerned that he may be too old for this position. I'll retract that statement.
Okay. Any further committee questions, discussion, and/or action? Senator Perry.
Mr. Chair, I would move that we have advice and consent for Stephen Zelmer as a committee for the South Dakota Building Authority.
Second.
We have a motion from Senator Perry and a second from Senator Melhoff for the executive reappointment, to advise and consent to the executive reappointment of Stephen Zelmer, Pennington County, Rapid City, South Dakota, to the South Dakota Building Authority. Would the secretary please call the roll?
Senators Melhoff,
Aye.
Dibert, excused. Hone. Aye. Carr.
Aye.
Kobeck, excused. Larson. Aye. Perry.
Aye.
Peterson, excused. Crabtree.
Aye.
Mr. Chair, we have 6 yeas and 3 excused.
After receiving a unanimous number of votes, the motion is hereby deemed passed. And since this is a reappointment, we can place that on the consent calendar unless there's any concerns from the committee. Seeing none. Next up is the executive reappointment of James Breckenridge, Minnehaha County, Sioux Falls, South Dakota, to the South Dakota Building Authority. We'll take proponent testimony at this time.
Don Templeton, South Dakota Building Authority. Jim may be on the line. He was going to try to dial in.
That's correct, sir. We've got him online.
Oh, great. I did hand out a bio on him. Jim's another sharp board member, super smart, great attendance with our board meetings. We're lucky to have a great board of directors, and so we appreciate it. Jim has served 3 full 4-year terms with the Building Authority, and he agreed to another one. Thank you very much, Jim. He graduated from Northern. He was past Chief Financial Officer of St. Luke's in Aberdeen, Senior Vice President of Finance for Avera Health for quite a number of years. He's just been in numerous hospital boards, and he's just a great board member. Thank you.
Thank you. We'll take further proponent testimony at this time. Any further proponent testimony in the executive reappointment of James Breckenridge? Seeing none, we'll open it on to opponent testimony. Is there any opponent testimony? Seeing none, we'll open it up to committee questions, discussion, and/or action. Senator Perry.
Just a comment. I've known Jim for quite a few years, and the guy is an excellent individual. He was, like they said, in Aberdeen, an Aberdonian, and he was really instrumental in Avera St. Luke's. And the other thing is, he and I shared the responsibility, or shared the history of being past presidents for the South Dakota chapter for Healthcare Financial Management Association. So it's just good to see his success. This person is a person that makes things happen, and I'm hoping that we all will vote for him because he deserves it.
Thank you, Senator Perry. Do we have a motion on the executive reappointment? Senator Melhoff.
Yes, I would make a motion that we advise and consent to the reappointment of Mr. Breckenridge.
We have a motion from Senator Melhoff and a second from Senator Perry. Any comments on the motion? Any further comments? Seeing none, I would just add it's good to see one of these Northern State Wolves continuing to serve. So that's fantastic. Go Wolves. At this time, the motion in front of the committee is to advise and consent to the executive reappointment of James Breckenridge, Minnehaha County, Sioux Falls, South Dakota, to the South Dakota Building Authority. Motion was made by Melhoff, seconded by Perry. Would the secretary please call the roll?
Senators Melhoff,
Aye.
Dibert, excused. Hone. Carr.
Aye.
Kobeck. Excuse, sorry. Larson.
Aye.
Perry.
Aye.
Peterson, excused. Crabtree.
Aye.
Mr. Chair, we have 6 yeas and 3 excused.
After receiving unanimous number of votes, the executive reappointment of James Breckenridge is hereby deemed passed and will be placed on the consent calendar unless there's any concerns. Seeing none. Next up is the executive reappointment of Matt Judson, Hughes County peer, South Dakota, to the Board of Economic Development. We'll take proponent testimony at this time.
Good morning, Mr. Chair and members of the committee. I'm Joe Fiala, Deputy Commissioner for the Governor's Office of Economic Development. Come before you today just to introduce Matt Judson and ask for your favorable consideration. Matt Judson, treasurer, grew up in Pierre, graduating from T.F. Riggs. He attended USD before then graduating at Augustana College with a double major in accounting and business administration. After returning to Pierre, he worked for both the South Dakota Department of Revenue and a local CPA firm. He started his employment with First National Bank in 1997 as commercial loan officer, then was promoted to branch president, and has recently been named Chief Audit Executive. Matt is an original board member for the Pierre Business Improvement District and previously served as treasurer for the South Dakota Development Corporation, as well as a board member for the Pierre Economic Development Corporation. Matt is very engaged in the Board of Economic Development. He brings a really good banking background, a good business mind, and he knows the Pierre region very well and brings a great perspective on the business environment there. Thank you, and again, I would just urge your favorable consideration.
Thank you, Mr. Fiala. We'll take further proponent testimony in the executive reappointment of Matt Judson. Any further proponent testimony? Seeing none, we'll move on to opponent testimony. Is there any opponent testimony on the executive reappointment of Matt Judson? Seeing none, we'll move on to committee questions, discussion, and or action on the executive reappointment of Matt Judson.
Mr. Chair.
Senator Perry.
I move the acceptance of advice and consent for Matt Judson as treasurer and being a board member of the Pierre Economic Development Corporation.
We have a motion from Senator Perry and a second from Senator Melhoff. Any further comments on the motion? Senator Melhoff.
Yeah, I know Matt Judson fairly well. He's a good man, and appreciate a yes vote on his nomination.
Any further committee comments? Seeing none, the motion in front of the committee is to advise and consent to the executive reappointment of Matt Judson, Hughes County, Pierce, South Dakota, to the Board of Economic Development. Will the secretary please call the roll?
Senators Melhoff,
Aye.
Dybert excused, Hone.
Aye.
Carr.
Aye. Thank you.
Kobeck excused, Larson.
Aye.
Perry.
Aye.
Peterson excused, Crabtree.
Aye.
Mr. Chair, we have 6 yeas and 3 nays.
After receiving a unanimous number of votes, the executive reappointment of Matt Judson is hereby deemed passed and will be placed on the consent calendar unless there's any concerns. Seeing none. Next up is the executive reappointment of James Schmidt, Lincoln County, Sioux Falls, South Dakota, to the Board of Economic Development. We'll take proponent testimony at this time.
Thank you, Mr. Chair. Joe Fiala, Deputy Commissioner of the Governor's Office of Economic Development. Again, come before you and ask for your favorable consideration of James Schmidt to be on the Board of Economic Development. James has a foot in 3 worlds: farming, county government, and affordable housing. He holds a bachelor's degree from Augustana University with a master's degree from the University of South Dakota. His work experience beyond the farm includes public school teacher, school administrator, and has served as a community college president. Jim is very involved in the community, being past president of the Sioux Falls Area Chamber of Commerce, past president of the South Dakota Association of County Officials, and currently serving as South Dakota representative for the National Association of County Officials. You can see all of the other organizations that he serves in or has been a part of, both in a professional capacity and in serving on nonprofit boards. Farming continues to be part of his life as he operates the family farm that was established in 1891. He and his wife, Terry, CEO of Experience Sioux Falls, have 2 daughters, Brittany and Brianna, a son, and some grandchildren and great-grandchildren. Again, Jim is a really good board member. He brings a good business mind. He's actively engaged, and he brings a perspective from the southeast corner of the state in that business environment. Again, I would urge your favorable consideration. Thank you.
Thank you. We'll take further proponent testimony on the executive reappointment of Jim Schmidt. Any further proponent testimony? Seeing none, we'll move on to opponent testimony. Is there any opponent testimony on the executive reappointment of Jim Schmidt? Seeing none, we'll move on to committee questions, discussion, and/or action on the executive reappointment of Jim Schmidt.
Mr. Chair,
Senator Melhoff.
I would motion that we advise and consent to the reappointment of Mr. Schmidt.
We have a motion from Senator Melhoff and a second from Senator Hone on the executive reappointment of Jim Schmidt. Comments on the motion? Any comments on the motion? The chair would just add that a number of years ago there was a big effort here to work on affordable housing and housing infrastructure funds. I did not know Jim Schmidt before that, but became fast friends with somebody who has spent a long time working on workforce issues across South Dakota, and he's fantastic on that board and a fantastic friend to have as well. So with that, the motion in front of the committee is to advise and consent to the executive reappointment of Jim Schmidt, Lincoln County, Sioux Falls, South Dakota, to the Board of Economic Development. Would the secretary please call the roll?
Senators Melhoff.
Aye.
Dibert, excused. Hone.
Aye.
Carr.
Aye.
Kobeck, excused. Larson.
Aye.
Perry.
Aye.
Peterson, excused. Crabtree.
Aye.
Mr. Chair, we have 6 yeas and 3 nays. Or excuse me, 3 excused.
After receiving a unanimous number of votes, the motion to advise and consent to the executive reappointment of Jim Schmidt is hereby deemed passed unless there's any objections from the committee. That'll also be placed on the consent calendar. Seeing none. Next up is the executive reappointment of Joy Nelson, Cottington County, Watertown, South Dakota, to the Board of Economic Development. We will take proponent testimony at this time.
Good morning, and hopefully for the third and last time, my name is Joe Fiala, Deputy Commissioner at the Governor's Office of Economic Development. Come before you to ask for your favorable consideration for Joy Nelson in her reappointment to the Board of Economic Development. Joy Nelson is a lifelong resident of South Dakota. She began her career at Farmers and Merchants Bank in Watertown in the real estate and student loan lending departments. She entered the real estate business in 1982 and is the broker-owner of Haugen Nelson Realty in Watertown. She's been engaged in real estate development, residential, commercial, and ag real estate for the last 42 years. She is also the founder and beneficiary of Joy Ranch outside of Watertown, a nonprofit facility whose mission is to serve people with disabilities, medical issues, and veterans through equine therapy, and also serves as a corporate retreat center. You can see a number of her awards and community activity that she's involved in. A couple I would point out is she is a South Dakota Hall of Fame member and a Watertown Hall of Fame member. She serves on the Lake Area Technical Institute Strategic Advisory Council, as well as a number of other things. Again, she is very involved in the community. She's got a great business mind and brings a good knowledge of the northeast corner of South Dakota and that business environment. And frankly, she is just a joy to work with. With that, I would ask for your favorable consideration. Thank you.
We'll take further proponent testimony on the executive reappointment. Any further proponent testimony? Seeing none, we'll move on to opponent testimony on the executive reappointment of Joy Nelson. Seeing none, we'll move on to committee questions, discussion, or action on the executive reappointment of Joy Nelson. Senator Perry.
I will go with action, and that will be to advise and consent for Joy Nelson to be a joy, because we have one on our team.
We've got a motion from Senator Perry, a second from Senator Hone. Any further comments on the motion? Any further comments? Chair would just add that I know Joy pretty well, and what if you were to look up in the dictionary what force of nature looks like, it would be a picture of Joy Nelson. Fantastic lady, and I'm thankful that she takes time out of her busy schedule to serve on the Board of Economic Development. We have a motion that was made by Senator Perry and a second from Senator Hone to advise and consent to the executive reappointment of Joy Nelson, Cottington County, Watertown, South Dakota, to the Board of Economic Development. Will the secretary please call the roll?
Senators Melhoff.
Aye.
Dibert, excused. Hone.
Aye.
Carr.
Aye.
Colbeck, excused. Larson. Perry.
Aye.
Peterson, excused. Crabtree.
Aye.
Mr. Chair, we have 6 yeas and 3 excused.
After receiving a unanimous number of votes, the executive reappointment of Joy Nelson is hereby deemed passed, and unless there's any objections from the committee, it will also be placed on the consent calendar, saying none. All right, we're going to move on to our bill hearings today. We're going to start with House Bill 1049, an act to protect electric infrastructure in this state. We will take proponent testimony at this time.
Mr. Chairman, members of the committee, Chris Nelson, Chairman of the Public Utilities Commission, we bring you House Bill 1049, which is an act to protect electric infrastructure in this state. As you are aware, several years ago, this legislature passed protections for the ownership of ag land in this state by 6 countries who, it would be fair to say, don't have our best interests at heart. And over the last, and then this year, Mr. Chairman's bill, SB 60, gets at some of those same issues. Over the last year, we've had a number of citizens that have come to us and just asked the question, well, what about our electric infrastructure? Is there anything that prohibits any of those 6 countries from taking ownership of electric infrastructure in this state? And the answer to that was, well, no. But, you know, it would probably be a very good policy of this state to say that that ought not happen. And that's what House Bill 1049 does. And so the operative part of this bill is on line 14 of page 1, where it says that if you are a prohibited person, and that's defined, that you cannot control, operate, or own any of the electric infrastructure in this state. It is really that simple. It establishes that is the policy of this state. But if there were ever an individual or one of these countries that violated this, the rest of the bill lays out the divestiture procedures to rectify that. Do I ever think those divestiture procedures are going to be needed? The answer is no, because I can't see anyone, even someone from one of these countries, making a huge investment in electric infrastructure that they ultimately will end up losing through that. And so the last thing I will say, frequently there's a question that comes up, well, is this a problem now? And the answer is no, but we don't ever want it to be a problem, because when if that were to happen, it would be too late. And so this is very prospective type legislation, Mr. Chairman. Happy to answer questions when appropriate.
Thank you. We'll take further proponent testimony on House Bill 1049. Any further proponent testimony? Seeing none, we'll move on to opponent testimony. Is there any opponent testimony to House Bill 1049? Seeing none, we're going to waive sponsor rebuttal. And I see Commissioner Fegan moving up when we said opponent. I was like, well, this is going to be interesting here. Okay, so we're going to waive sponsor rebuttal and move on to committee questions on House Bill 1049. Senator Larson.
Question for the prime sponsor.
Go ahead, Senator.
Sorry, can you point me to the list of these countries? Once again, I know it's in, I'm not seeing it in here, and I know in my mind I have a sense of what they are, but I just want to make sure.
If I might, Mr. Chairman, yeah, that list is found in 5-18A-1. It is Russia, China, North Korea, Iran, Venezuela, and Cuba. And if I might just follow up, so then the obvious question is, well, why didn't you put those 6 right here? And the reason we didn't do that is we want a consistent list, whether it be for the Ag statute, for this statute, for Senate Bill 60, and those names may change over time, and so we didn't want to hard code them into this legislation.
Senator Larson.
Thank you, Mr. Chair. Oh, that's great, and I think that's a good answer. Just another question here about people who are dual citizens. You know, there are a lot of people who are dual citizens of their home country and here, especially, and I'm thinking in the case of China, you know, even if there are just a lot of dual citizens that live in the United States, they're legitimately American citizens, but they hold the citizenship of more than one country. Sometimes you can even hold 3 citizenships. So I just want to make sure that those people don't face unintended consequences because they are American citizens. Could you address that?
Go ahead, Commissioner.
If I might, I think that's answered on page 1, line 11, where it talks about an individual who is not a United States citizen as being prohibited. And in your illustration, they would be a United States citizen plus.
Follow up to that, Senator Larson.
So it does say somebody who's not a United States citizen, but is a citizen of a country listed in, the list of the six. So there could be a contradiction there if someone is a United States citizen, also a citizen of one of those countries. And I know there are certainly people that fall into that category.
If I might, Mr. Chairman, maybe we're reading it differently, but what this is saying to me is that you would be prohibited if you are not a United States citizen, but you are a citizen of this other country. You'd have to meet both of those criteria. And for the people that you're talking about, they are a citizen of the United States and so would not be prohibited by this.
Thank you.
Further committee questions on House Bill 1049? Any further committee questions? Seeing none. Move on to committee discussion and/or action on House Bill 1049. Senator Melhoff.
I would move do pass.
We have a do pass motion made by Senator Melhoff and a second by Senator Hone. Comments on the motion, Senator Melhoff.
Well, I think the testimony by Commissioner Nelson was pretty instructive. It's not a problem now, and we don't want it to be a problem later.
Further committee comments on the do pass motion? Senator Hone nods in agreement. Any further committee discussion on the motion? I would just say well done to the PUC and the folks that put this together. This is some good common sense legislation. It's good to see this brought forward at this time. In front of the committee, the motion is do pass. It was made by Senator Melhoff and seconded by Senator Hone. Would the secretary please call the roll?
Senators Melhoff.
Aye.
Dibert, excused. Hone.
Aye.
Carr.
Aye.
Colbeck, excused. Larson.
Aye.
Perry.
Aye.
Peterson, excused. Crabtree.
Aye.
Mr. Chair, we have 6 yeas and 3 excused.
Thank you. After receiving a unanimous number of votes, House Bill 1049 is hereby deemed passed. Unless there's any concerns amongst the committee, we'll place that on the consent calendar. Seeing none. Next up is House Bill 1027, an act to update certain citations to federal regulations regarding pipeline safety inspections. Go ahead, Commissioner Fegan.
Thank you, Mr. Chairman and members of the Commerce Committee. Christy Fegan with the Public Utilities Commission. First of all, thank you for the good senator, the chairman that put our bills on here today. I will be working on regional transmission organizations next week and cost allocation, protecting our co-ops, municipalities, etc. So I will be gone. But Mr. Crabtree, really? Your reading of the title is all the testimony I need. We have been here 17 times since 1994, just adjusting the reference. This year, there's really hardly any changes in the pipeline safety standards. The addition of drug and alcohol testing with saliva testing is the major difference. Just a quick reminder, we have 2 inspectors. We oversee about 5,600 miles of distribution, about 300 miles of transmission, natural gas lines, and we would appreciate your vote. And there are no votes in the House, on the floor or on committee, so we'd love to keep that up.
Well, we don't care what those guys do. Further proponent testimony on House Bill 1027. Any further proponent testimony? Seeing none, we'll move on to opponent testimony. Is there any opponent testimony on House Bill 1027? Seeing none, we'll waive sponsor rebuttal and move on to committee questions. Any committee questions on House Bill 1027? Any committee questions? Saying none, we'll move on to committee discussion and/or action. Senator Melhoff.
Move do pass.
We have a do pass motion made by Melhoff and seconded by Perry. Comments on the motion, Senator Melhoff?
No, I think the title says it all, and we could just pass it to the floor.
All right, perfect. Any further committee comments on the do pass motion? Seeing none, the motion in front of the committee is do pass on House Bill 1027. Will the secretary please call the roll?
Senators Melhoff.
Aye.
Dibert, excused. Hone.
Aye.
Carr. Aye. Colbeck. Excused. Larson. Perry.
Aye.
Peterson. Excused. Crabtree.
Aye.
Mr. Chair, we have 6 yeas and 3 excused.
After receiving a unanimous number of votes, House Bill 1027 is hereby deemed passed. Unless there's any objections from this committee, it will be placed on the consent calendar. Seeing none. All right, that concludes our work for today. We're going to hold off on House Bill 1038. There's an amendment that was just posted, and I would like Senator Colbeck to be back as we look at that. We are very fortunate in this committee to be able to have a former PUC commissioner to help guide us on some of those, and so we'll wait till next week and pick that one back up. And we won't adjourn yet, and this is the other reason why we need to get going is because we've got the Madison Little legislators here. And so welcome, guys, to Commerce and Energy. You're about to see the most exciting part of this hearing, which is the adjournment. But for those that aren't familiar and those that are in the crowd right now, the Madison Little legislators are in the Capitol today with their teachers. They're 4th grade students at Madison, and I tell you what, I've been part of the program they run there, but those kids know more about the legislative process than I think, frankly, some of us that are here. So they do a fantastic job. They pass bills, they write bills, they pass bills. They defeat bills amongst themselves, and I think the only thing they haven't done is overridden a veto from Principal Guzzi, and so we'll work on that. We'll work on that together this year. And so, little legislators, welcome. It's good to have you. So, with that, I think that wraps up our hearing for today. Senator Perry wants to give a round of applause to the kids. Well, I'm going to go show them the Senate floor at this time. So I would take a motion to adjourn, moved by Perry, seconded by Carr. All those in favor say aye. Aye. All those opposed say nay. We are adjourned.